Contact tracing is vital in breaking the chain. Apps do some of the work, but much of it is manual. And when COVID rates surge, keeping track of endless lists of contacts is almost impossible.
When the numbers are going up so fast and the cases are so large, is that the system is simply not functioning well anymore.
Experts say that's not an argument against contact tracing. Rather, they say it needs to be ramped up. Well, Turkey is one example of where contact tracing was working, but new infections are on the rise again. People are letting down their guard, and critics blame the government. DW's Yulia Han reports from Istanbul.
The city of 16 million, in which the coronavirus is spreading. And one of the teams that are fighting to stop it. Gülgün Emircan is a dentist. At least she was, until the pandemic started. She's been a contact tracer since March, one of around 35,000 in Turkey. Seen from here, the size of the city can be scary, and I sometimes wonder where this pandemic is headed. But as a doctor, I have a responsibility. I try to think positively, and knowing that I help people is what motivates me and keeps me going. A tracing team manages around 10 house calls a day. They work in shifts almost around the clock. The goal is always the same: track down, test and isolate those who've been exposed to someone with COVID-19. And all of this as quickly as possible. Gülgün's first case today is the Kulaksizolu family. The mother recently tested positive. Now the father has symptoms too. If the test is positive, Gülgün will also try to trace his contacts. The whole family has to stay at home for the next 14 days. After each visit, protective clothing has to be changed. Gülgün's job is time-consuming and strenuous, but it's worth it, she says. Few countries expanded their contact tracing capacity to the extent Turkey did. These teams were key to slowing the spread of the virus in spring, health officials say. But now, like elsewhere in Europe, the number of infections here is on the rise again. As in many other countries, people's vigilance here has slackened. In a recent survey, more than half of the respondents in Turkey said the coronavirus does not affect or worry them. And critics also blame the government for this lack of concern, because the health ministry no longer reports the number of new infections every day, but only the number of symptomatic patients. Canan Kaftancıoğlu of the opposition CHP says the government is hiding the real scope of the pandemic. Here in Istanbul alone, the number of cases is 20 times higher than the tally from the Ministry of Health. I'm saying this with regret, but the figures and information we are given are not correct. Gülgün Emircan is on her next house call. She does not want to take part in political discussions. She knows the debate about the numbers, but doesn't want to get involved. That more and more people disregard the coronavirus rules frustrates her. It makes me sad. We're putting so much effort into this work. But what's the point if so many act as if nothing can happen to them? And if this doesn't change, we won't see an end to this pandemic. Gülgün hopes that she will soon be able to work as a dentist again. But she also knows that her new job will be needed for quite a while.
Well, Tobias Kort is director of the Institute of Public Health at Berlin's Charité. Good to have you on the show again. How important is contact tracing for your job as an epidemiologist?
I think it's very important. It's a crucial step in fighting the pandemic. So you need to have test results. Obviously, the laboratories need to be in place and functioning. And then you need to have staff who actually trace track down people who may be infected, test them and isolate them if they test positive. It's a very important and crucial aspect.
And what about these contact tracing apps? I mean, surely we could do things so much quicker and more effectively with these apps, but do they actually help stop COVID-19?
There certainly is this. The issue with these apps is that they do not work on all the smartphone platforms. So you need to have a relatively new generation smartphone plus the software. Not all can afford to have a smartphone. So if not all of us have a smartphone, then it already has limitations. And so that's why it can assist the process, but it's not the solution to stop the pandemic. Yes.
Okay, so there's already a divide there emerging between rich and poor. What about the skeptics, though, the people who just don't trust the technology?
Well, there's always you have issues in terms of like data protection, which is a very important point. But I think especially here with the app in Germany, they did a very good job in making sure that none of personal data is actually transmitted. But of course, there is a concern and some people may feel uncomfortable. So we need to work to really make sure that people understand the importance of having this app should it be available for all the smartphones that we are wearing.
And the importance is, as well, that it only functions if a certain amount of people do actually download the app.
That is correct. If you don't have the app, if you don't have a smartphone, the app will not realize that you are close to someone who may be infected and will not give that signal to you that you may be at risk of getting the infection or having a contact that is infected. So it's very important that people download and work with the app, obviously, that this app is actually working and this mechanism in terms of tracing with the app is actually functioning.
Tobias, talking about the functionality and the effectiveness of these apps, why didn't we get a Europe-wide app at the very beginning of this crisis?
That's a very good question. I think the European Union is not really taking a good steps in acting jointly. So we obviously need to have a good functional European solution, and we should have had a European app that if you travel to France or to Spain or to any other European country, that it works there as well and not just within your local setting.
How did Istanbul manage to do such a good job of contact tracing initially before this second wave?
As you've shown in the report, they had mobile teams that are going from door to door, so to say. It's a lot of manual work to trace the people who have been in contact with someone who is infected. And that really helps. As I mentioned before, it's a crucial step. And we're doing the same job in Germany, but if you reach a point where you have just too many cases, these systems just don't work anymore. You're overwhelmed with the number of cases, and no matter how well organized you are, at one point it won't be enough. You won't have enough staff, you won't have enough people on the phone, you won't have enough people on the ground who are actually able to trace and test and isolate. So that's why the system works very well up until a certain threshold, and then the system stops to work. Similar things happen in Germany about mid-end September.
So would you say Germany is also overwhelmed by the situation?
Yes, we're currently overwhelmed by the situation, so we are behind the wave, if you wish, and we need to get in front of the wave and actually be able to test and trace, and that's why we're having the measures in place to actually have the number of people who are testing positive in a range where we can start to trace and test and isolate again.
How do you see the situation developing now over the coming weeks and months here?
Well, what we have to understand is like the so-called lockdown is not a cure. It's a reset, so to say. So you reduce the number of people who are infected to a threshold where you can act with the tracing and testing and isolating. And as soon as you open up a little bit, the number will increase again. And then the question is whether you can achieve a balance where you are below the threshold where the officials can do their work and we can trace and test. But the risk is that you go over, and then we're having the issue as we have right now. So the situation of the pandemic will be resolved as soon as we have a vaccine available and enough people who are vaccinated.
Tobias Kort, Director of the Institute of Public Health at Berlin Charité. Thank you very much for joining us today. Really interesting stuff.
Thank you for having me.
Well, enough from me. Time for you to ask the questions. Here's our science correspondent, Derek Williams.
Which COVID-19 diagnostics are most useful from an epidemiological point of view?
There are basically three types of diagnostics that play useful but different roles in the fight against COVID-19. The first two are for determining whether someone has the disease or not. The gold standard for doing that is what's called a polymerase chain reaction, or PCR test. It works by amplifying tiny amounts of any viral genetic material available in a sample up to levels where it can be detected. Although no test is 100% reliable, PCR tests are very accurate. On the downside, they're also slow and fairly expensive, which is a drawback when numbers of cases are rising rapidly. The second class of detection diagnostics, called antigen tests, work by detecting viral proteins directly. Antigen tests are cheaper and they can deliver a result in minutes, but they're also less accurate than PCR tests, which is a particular problem when it comes to what are called false negative results. That's when people actually have the virus, but because the test says they don't isolate. Still, the speed and low cost make antigen tests important tools in scenarios where infections are spiking and a lot of people need to be tested quickly, and they can often be performed on site, so samples don't have to be sent off to specialized labs. The third diagnostic in the COVID-19 pandemic that's playing an important role is what's called a serological test, generally called an antibody test, which detects proteins called antibodies that form in the body as part of the immune response. They can tell doctors if someone was infected, at least in the recent past. Serological tests also play a key role in vaccine development, since they can show whether a candidate is having the effect that we want, which is to prompt the immune system to produce antibodies.